GrindRelief PRO. Instructions for use. GrindRelief is a mouthguard intended to protect against clenching and grinding or bruxism. Do not form the GrindRelief without reading the instructions and watching this instruction video through to the end. GrindRelief may be fit on the upper or lower teeth, whichever is free of problems which are listed in the warnings or contraindications of your instruction sheet. Before viewing the general fitting instructions, there are a few possible obstacles to achieving a perfect fit. The most common issue is the thermoplastic can shrink after forming the device, making the fit too tight or unable to seat even a week or two later. This is easy to solve. Simply immerse the GrindRelief in microwave water approximately 160 degrees for 5 to 10 seconds and place it over the teeth. Lift it on and off several times as it comes to complete set and remove. Do not shock it under cold water. If the device is too loose, place it in microwaved water for about 30 seconds. Press the thermoplastic back into the tray and seat device. Hold it in place until it sets. Most people prefer to wear this device on the lower arch. However, some may have a better fit on the upper arch. There is no limit to reforming the device and getting the ideal fit you want, even if you have to fit it a few times to get there. Forming instructions. Partially fill a mug or bowl with water, then warm in a microwave for 90 to 120 seconds. Water bath and instant hot water faucet may also be used. Use caution, the water will be hot. Submerge GrindRelief in heated water. It should be approximately 160 degrees Fahrenheit with the smooth shell side down for 90 to 120 seconds or until the device is completely translucent. Remove GrindRelief from the water. Be sure it is not too hot to the touch. Fold the softened thermoplastic into the hard plastic tray for better control of the flow. Place the GrindRelief over the mandibular anterior teeth using the central power bar as a guide to center the device. Use the fingers to press down lightly on the device to gently seat it on the teeth. Border mold. Tuck any excess thermoplastic into the shell. With index finger, smooth lingual side for a more comfortable fit. Have the patient bite down for 90 seconds to further seat the GrindRelief until pressure is felt, mainly on the upper and lower front teeth. Do not use excessive force. Gently rock the GrindRelief up and down to avoid possibility of lock-on. Then have the patient bite back down 60 to 90 seconds. While fitting, do not leave on the teeth longer than 90 seconds without lifting it off. Remove GrindRelief and then reinsert in the mouth to confirm the fit. Any sharp or uncomfortable edges may be trimmed with scalpel or suture scissors. Edges are best trimmed when slightly soft. Forming on upper teeth. Use the same method as the lower, but be sure to push GrindRelief back as far as possible against the front teeth, then gently bite teeth together, bringing lower teeth forward to bite on the power bar for 90 seconds. Complete fitting as described for the lower teeth. If patient comfort becomes an issue, the anterior dome may be removed by trimming on a model trimmer or stone wheel. While the GrindRelief alone works quite well in most cases, we have found it quite beneficial to improve the performance by including a clear retainer splint to be worn opposite of the GrindRelief PRO. This addition slightly increases the vertical and gives a more free glide path for the mandible and perfect anterior guidance. Chipping of teeth and tooth movement are rare, but they can occur, and the retainer splint will help prevent it, along with better performance from the whole system. Again, this is only an option and not necessary in most cases. Clear plastic vacuum form sheets are included in the GrindRelief PRO pre-pack for this purpose.